Hello, good afternoon and welcome. My name is Ian Watkinson and I'm a National Executive Member from the North West and also Chair of our National Health and Safety Organising Forum. And it's my pleasure to welcome everyone to this first session, A View from the Regulator, as part of our National Health and Safety Month. Normally in November, we'd be looking forward to meeting up for our annual 3-day Health and Safety Advisor briefing, but for obvious reasons, we can't. But thanks to the hard work of a team of national officers led by Sarah Lyons and the National Health and Safety Organising Forum, we've an excellent month programme of health and safety webinars and training instead. So with that, I'd like to welcome and pass you over to our speaker, Andrew Kingscott, who heads the Health and Safety Executive Team that focuses on education. Andrew, welcome and over to you.
Well, thank you very much, and thanks for the opportunity to come and speak to you and share some thoughts. We weren't quite sure what to call this, so I think in desperation we called it A View from the Regulator, and I guess that's kind of where we're at. What I wanted to do today was to share a number of things with colleagues, but primarily talk about some of the reflections and some of the issues around the intervention programme that we're looking at in terms of schools to look at COVID compliance. I wanted to touch on, because it's super important, is mental health and well-being. And I also just wanted to mention some issues around asbestos in schools, but clearly at the moment our focus is in and around COVID and COVID compliance, and certainly that's hijacked the majority of my agenda currently and is the area that I'm focusing on. As I guess we all are, but I'm very aware that colleagues in education are focusing very much on maintaining the delivery of education on all fronts in what is a super challenging environment, and that's something that I and my colleagues in the HSE fully appreciate and understand. And the whole context of this is, regardless of perhaps how it's been received, is that it really was trying to be helpful, trying to provide some assurance, trying to provide some support to schools, and it certainly wasn't looking to make your jobs any more challenging than they currently are. But look, we'll touch on that as we go through, and there's an opportunity to ask questions. But just to set this in context, really, what HSE was asked or tasked to do was to be part of this wider government response to look at spot checks across all workplaces and to assess compliance and offer that wider assurance both to employees, union members and the wider public that transmission in the workplace was being controlled. And in the school setting, compliance is then pegged to the guidance for schools. And as you will all be aware, and painfully aware, because it's updated at increasing regularity and at some interesting times, that this is pegged to the schools guidance. It's certainly in England prepared by the DFE, and then the Welsh Government, the Scottish Government have their separate guidance, which are pretty much closely aligned. And as I said, this is being updated at pace. It's being updated to reflect emerging science and knowledge. And I think that one of the starting points was just to recognise that this guidance wasn't necessarily a one-stop shop, in the fact that actually it was the best that could be achieved, I guess. At the time, it was something that was going to be added to, but it wasn't as complete as it could be, and it was always looking to signpost other guidance. And I think to some extent that's perhaps been a challenge and a message that's been missing. But what it has tried to do is reflect the duty on the employer. But as I said, we may need to look beyond that guidance and signpost or look at the other elements that signposts. So the element about schools is sort of super important, really, because you've got a very important component that, regardless of all of the lockdowns and the tiers and all of the other confusing measures that have been ongoing, the stalwart or the continuity issue is schools, and you have been asked to remain open and maintain a full capacity. And we don't underestimate the challenge of that. But clearly, as we are in the period of lockdown, schools now remain one of the areas whereby there is still a significant potential, and I use that advisedly, potential for transmission, because many of the other transmission routes are now closed. And therefore, perhaps it's even more important now that we make sure that we get this right and in all of our settings. And therefore, that's one of the reasons why we've made the decision that we will continue to do this. I note that there will be some criticism, pushback to say, well, what are you doing coming into our schools? You're a transmission risk. We work very carefully. We're not looking to add to any burden. We're not looking to provide a risk. We're going to work to very strict protocols and make sure that we are fully COVID compliant. But as I said, this is a statutory regulatory visit. This is something that's seen to be increasingly important to be able to give that assurance, and where clearly there are issues that need to be addressed, well, look to see how we nudge people in the right direction to get them there, to update them and give them the confidence that, look, the challenges in your setting are difficult. You're not alone here. Other people have got these challenges. We can share some good practice and we can reflect and perhaps give them the confidence that, look, your efforts aren't in vain. They might need tweaking here. We might need to look at that. But look, generally, you're going in the right direction and to most extent, you're compliant. So the rationale, I mean, this isn't just something that I've dreamed up as head of the sector that leads on education. This is an HSE Exco decision. The decision was to be able to reach out and look at as many schools as we can. I appreciate that there was a call by other unions to say, well, HSE is not doing enough. Our challenge is that we've only got a certain amount of resource, and it's thinking about how we use that resource as effectively as we can. Clearly, we will always respond to concerns, and that makes part of the inspection programme, that where concerns are raised through the normal channels, that we would deal with that. But what we looked at was a two-stage process. One was to try and contact as many schools as we could. The decision was taken to contact 5,000 schools, and they were made by telephone calls. Now, we appreciate that that wasn't necessarily a straightforward process. Trying to phone a school and get them at an appropriate time when you can speak to the appropriate person is relatively challenging, particularly in the smaller settings, where we appreciate that the senior leadership teams and the bursars and others have other roles, not just a management role, and therefore aren't always on the other end of a telephone. And what we looked to do was an early assurance process to make inquiries and put a series of questions, which I think a number of people would have seen, and I know that some of this stuff was released on Twitter. And we were trying to cover the key areas to make sure that schools were aware of the guidance, that they had those management arrangements in place, that they'd done a risk assessment, and all the intentions were there. But this wasn't a process of validating, this was a process of assurance. And the key in any instance after a risk assessment is to make sure that those controls are implemented, to make sure that they are maintained, and most of all, to make sure that they remain effective. And so there was always the element, perhaps, which wasn't as best communicated as could have been, because we worked with colleagues in DFE, Welsh Government and Scottish Government to make sure that we got that messaging out there. It hasn't necessarily landed as well as I would like, but the second phase where we would undertake a series of visits. And again, we'd look at trying to undertake a significant proportion of those visits and look at the findings as we go through and amend or update the need as we go through. But those visits are ongoing. We've probably done around 400 to 500 of those now, and they'll be continuing over the next couple of weeks. So I'm not going to put a target on how many we've got. We're going to review the findings in the next couple of days or so and take a view as to whether or not we continue. But regardless of however we finish, we will still continue to follow up on concerns and may then visit schools in the future, even if it's not part of this wider programme. So this is an intelligence-led approach to the visits. Some of the visits have come out of the fact where we have undertaken the calls, and perhaps the calls didn't necessarily give us the confidence that all of the issues that we would want to look at were being addressed. We also clearly, to make sure that we've got some comparisons, look at schools which had given us that confidence, and then a wider random sample in some cases of schools that hadn't been contacted. I didn't want people just to think that, you know, if I haven't been contacted by the HSE, we're not going to get a visit. That's not how it works. You always don't expect the Spanish Inquisition anyway. To some extent, you know, we wanted to make sure that all schools to some extent are in scope. what we wanted to do was use these as validation visits. Now, that's validation that the controls that were identified, that were actually in place, that they've been implemented, the management arrangements were in place, mostly important to monitor that the control measures were working and ensure that they're updated in the light of when they identify perhaps that they're not working, or they could identify things that didn't work as planned. And I'm sure most schools started off when we've made those amendments and tweaks, and then updated in the light of emerging benchmarks and updated guidance, as I've said, not least of which is the idea of ventilation, which is proving to be a challenging area, but I think we're progressing on that and moving forward. We started off relatively small here, so we started off with some schools in Scotland. As you appreciate, colleagues in Scotland are about a month ahead of us in England and Wales, and we visited a significant sample of schools within Scotland. We've issued a press release, which you may well have seen, and I think that what we reflected that it was a broadly positive experience. There was good knowledge, there was significant efforts made by staff and their senior leadership team. We provided advice, we provided guidance, we provided a steer to focus on priorities within those settings that we visited. So our findings there were 80% of schools had a good understanding. Many schools had reacted very quickly to implement the new measures at pace. There were some common areas of concern that we identified, and that's centered around social distancing in staff areas, cleaning regimes, and some uncertainties around ventilation. We certainly found some novel solutions. We found some great examples of good practice, and we found some wider benefits associated with having much tighter controls, which are sort of almost unexpected spin-offs, such as reduced levels of bullying, reduced levels of damage or vandalism within schools. And I know that that's no compensation in any event, but it is a sort of useful side effect of having that element of additional control. But we also recognise that social distancing has quite a significant impact upon the teaching profession, and the fact that we can't meet as we used to, the fact that we haven't necessarily got that sort of peer review or that peer support network. And like ourselves and everybody else, I guess, who's working from home, we kind of miss that element that's absolutely essential, and that peer support is really, really important. And to some extent, that makes life more challenging. So, as I said, we've started then the visits in England. We've perhaps done, as I said, over 400 to date. There's a slight time lag in terms of actually getting us to the point whereby we can have that current information, because the inspectors need to go there and make those reports, and we're then reviewing that. I think although we've had some pushback, and there have been some concerns raised about perhaps how we've gone about it. Perhaps there's some anxiety, some fear, some concerns about how HSE will approach this. In most instances, we've been mainly welcomed, we've been well received, and people are grateful that we've been and had a look. And as I said, in most cases, all but perhaps 1 or 2% of cases, most of the work that we've done and amendments that needed to be made have been made by just discussion and advice and pointing people in the right direction. And we've only had a very few instances where we've had to resort to putting those elements in writing, which clearly is the threshold for a matter of evident concern, and that's us writing to them, and as we set out previously, that then attracts our charging regime. But as I said, that's a very, very a small point and a small number of schools that fall into that category. And what we've really tried to do is assist the idea that, you know, this is really setting led. What the guidance does is put together this goal setting approach, if you like, but it is about being setting led. So no two settings are the same. The solutions will be broadly similar, but they will be site specific. It's as far as is reasonably practicable. We're controlling the risk. We're not looking to eliminate the risk. It's not possible to eliminate the risk. And we're enabling then the controls to and schools to be able to continue in the safest possible way. So, as I said, what I wanted to do was just sort of share with you some of the key areas where we'd identified shortfalls and share some of the positives. But I think the bit that we've recognised most is that the considerable effort that's being put being undertaken by everybody in the teaching profession. Every time I meet with the teaching profession, every time I go into schools, I can't help but be impressed with the efforts that people are making, the level of care that they're taking, and just the sheer amount of work that they're putting into making sure that they're getting this right. In terms of the output, I'm not looking to manage expectations, but this isn't an area where HSE is looking to have a huge report. This is really an element whereby the visits are setting related, and therefore we would feed back in those settings. But I think that what we've done is shared then some of the wider lessons or some of the wider issues that have come out just for sort of good practice or sharing it, or just really to reflect that. But this isn't a question of having anything that's going to be a formalized report or signed off on. So perhaps just to give you an indication, I think that what we found is generally positive. There are issues clearly around mental health, well-being and stress, because we're being pushed to do more, but we're managing it well. But you know, the reality is that at the moment there's no end in sight. And we recognise that there is more impact upon teachers, and that's more challenging. I think when I look at the elements associated with so we've looked at a number of key areas. So the first one we looked at was risk assessment, and in the main, I think risk assessment's understood. I think that health and safety perhaps has been repositioned now in education, as it has in a number of other sectors, whereby health and safety is now seen as a solution rather than a problem. I think that that's actually very helpful, because it is about making sure we break down barriers. It is to make sure that we enable things to happen safely, and therefore we are then part of the solution. I think the challenges for risk assessment is one of proportionality and one of ownership. We've seen risk assessments running to 79 pages, and you can look at the value associated with that. We've seen ones that are a couple of sides of A4, and again, you know, it is horses for courses, and it's what's proportionate in that setting. But there is an issue associated with the way in which the risk assessment process is done and how that's recorded, and whether or not there's sufficient detail or simply just too much detail. So that's about getting that right. I think we've seen other areas whereby what's happened is that some trusts or some local authorities have provided a template, and what that hasn't necessarily done is been converted then into the site-specific control measures. That what they've done is sort of taken the strategic or broad brush approach that schools should adopt, but we haven't necessarily looked to tease out in sufficient detail as to what those controls are actually going to be in that setting and what good looks like. And therefore, if we haven't set that expectation, it's very difficult to monitor against what it is that we've intended to do. And I think that, as I said, some of the risk assessments perhaps haven't necessarily addressed ventilation or made it clear what they're going to do. The second area we looked at was management arrangements, and in most cases, you know, we have stepped up. People recognise that we've got responsibilities. We need to take control. We need to show leadership in these settings. It is one of the challenges is in around, well, how do we actually monitor? So I think schools and we're finding other employers are the same. We're very good at planning. We're very good at the doing, implementing things. But what we need to do is actually monitor that these things are in place and they're effective. And some of the shortfalls we've found is around, well, what's the monitoring activity here? How are you ensuring that what you intended to do is actually happening? How are you recording this monitoring? And that obviously sits with the employer, and there's a question there for local authorities as to, well, what are you doing to ensure that, you know, in the difficult circumstances you've got, that your employees are safe and that there's monitoring arrangements there. So it is about that oversight. And I think that one of the other challenges around some of these issues that we found in some areas is about how we communicate all of the messaging, particularly the messaging to students, the messaging to parents. We've seen some difficulties around cultural issues. We've seen some issues around language barriers, and making sure that, those people who need to support pupils coming into school clearly understand what is expected of them, so that they know how they need to behave and what equipment they need to bring with them. In terms of sort of issues with social distancing, in the main, I think it's been very positive. We certainly recognise that social distancing will again be a site specific solution depending on the key stage, depending on the activity, and depending on the relative needs of the individuals there. As I said, the key stages as to where we're at. I think we had some difficulties at the outset about how we get everybody into a setting, how we move everybody around a setting, and how we get them safely off of the school site at the end of the day. And those are areas that we've seen some significant improvements in. We've seen some superb solutions in terms of one-way systems and revised arrangements, separate doors, separate organisations. As I said, queues outside schools were a problem. We've had issues with neighbouring schools. Schools seem to be in close proximity to one another, juniors and secondary schools, and there's been some confusion or perhaps lack of cooperation in terms of the way they turn out, and we turn everybody out into the same lane at the same time, which becomes a challenge. And whilst the focus, I think, to some extent has been on the students and how we can ensure social distancing in the students, it's become more of a challenge as we go back to the full offering. And sometimes I think we've missed the areas about the staff. Staff rooms haven't got any bigger, staff facilities haven't got any bigger, and there are some issues where perhaps we haven't necessarily addressed some of the social distancing around staff. This isn't an all or nothing approach. This is about trying to maximise the or minimise the risk by maximising the amount of time in all settings where we can be as staff 2 metres from our charges, even though what's practicable in each set of circumstances, depending on, as I said, key stage and all the other factors, will differ. As I said, social distancing is one of the biggest challenges because there isn't necessarily the requirement to do that within the cohort, but certainly as we've seen, and I think is testimony to everybody there, is that in most settings, actually the transmission across the bubbles has been limited, which means that actually the controls in most settings have been very effective, because that was the intention as to what was being led by public health. We're very clear that this isn't necessarily a health and safety issue. This is why HSE haven't written the guidance. This is very much a public health led issue. And we are, as I said, trying to regulate against a moving target, regulate against the DFE guidance and the wider guidance there. And it's not for us to produce separate guidance, although where we found that there are gaps, we have then tried to do that. I just want to touch on sort of hygiene and cleaning. Again, I think it's been very good. I think people have stepped up, and I think people are spending a lot of money here in terms of having enhanced cleaning. But I think the success here is trying to understand what enhanced cleaning looks like. We've had some interesting conversations. What are you doing about your cleaning regime? Well, we've enhanced it. Yeah, but what does that mean? And I think that when we push, and it's not that clear what actually they've asked for, what they're actually getting, and just from a sort of contract management point of view, it's helpful to understand what you've asked for, what you're expecting. Are you getting value for money? Is it effective? And so although this isn't about a detailed analysis of tick this every time that you've been there and cleaned it, it is a question of knowing that the cleaning and the enhanced cleaning has been done and it's validated. There was a gap, as I said, in terms of ventilation. I'm hoping that we've filled that gap. I'm hoping that what we're trying to do is take a sensible approach in schools about this idea of the balanced approach between thermal comfort and in respect of trying to maximise the amount of ventilation and fresh air ventilation that we can achieve in that setting. It is a difficult balancing act. It is that we need to think about that. It's a sort of one-stop shop. We need to think about how we can update and amend that. And to some extent, actually, some teaching colleagues and caretaking colleagues might need some assistance and some steer as to how they then set mechanical ventilation, or how we would seek to adjust ventilation during the day and react then to a changing environment when we're outside. When the temperatures outside are different, or when we've got worse weather. And it's a question really of being alive and adapting to that. I think that was what I'm sure we'll get some questions on that and our approach. So I was just going to move on to something else just briefly, and recognise that, look, we recognise that COVID has perhaps hijacked the agenda. We really wanted to do some more work associated with teaching and looking at the wider issues, particularly around mental health and well-being, and perhaps around violence and aggression. We recognise, again, if you've seen the stats, I'll share them with Sarah and perhaps you can share them on, but if you've seen the stats came out yesterday, and it's not showing a good picture. The recognition that mental health and well-being is deteriorating. The levels of ill health and absence due to anxiety, depression, and mental ill health is becoming problematic. And again, it's more important that it's reflected poorly in the education sector. I think you're fourth only to, for various reasons, wider public service. I'm going to say utilities and military and the police, but you know, we're way up there and way above what is the natural or the norm. I think 1,500 per 100,000 is the UK average. Education is at 2170 per 100,000, so a significant increase over normal levels, or not that any levels are acceptable, but way above then the average. And I think that what I'm doing is broadly welcoming. I think that you would have seen, I hope, then the charter that's coming out from the DfE in respect of what their role is. We look to work with them on that. It sets out a series of commitments and principles, this idea of a shared responsibility. And what I want to try and do, although it won't necessarily be me taking this forward, is to make sure that we feed into that, we complement and align our approach to ensure that employers better understand the compliance benchmarks and the component of work-related stress that's under their control is addressed and they're held to account. But quite clearly, the DfE are looking then at this wider issue associated with the wider implications of the political agenda and the work that Ofsted do in terms of the other impact. I think the second bit that I just wanted to touch on, I recognise I'm perhaps overstaying my welcome, but the recent prosecution you would have seen in the Luton Borough Council, which related to a very serious incident in 2006, where a member of the teaching staff had a sustained assault with a mobile phone and received life-changing injuries. That was a case that HSE took very seriously. We appreciate that violence and aggression is a huge issue. It's a huge source of stress, but it also accounts for 9% of non-fatal injuries to employees. And so this is a huge problem. And what we found was, with the investigation and shared with the court, that there were significant shortcomings in relation to the measures at the school. This is a school that's under local authority, or was at the time under local authority control, and the teacher was an employee of the local authority. The local authority, or the employer in this case, hadn't ensured the school had people with sufficient competence in training in place. They didn't see to it that members of the school had the training to remedy the shortcomings, to deal with violence and aggressive pupils, and they failed to monitor the adequacy of those measures. And that was the comment that I've made that runs through most of the messaging that I've got, that yes, we plan, we do, but what are we doing to actually monitor and it's effective? And what the outcome of that was that the council therefore had picked up and had failed to pick up that there were shortcomings, and hadn't recognised this and hadn't then done anything. And quite rightly, the court held this highly. They suggested that they agreed that it was right and proper that the HSE brought this case. The fine is I'm not going to say is largely irrelevant, but the local authority were fined. The fine was obviously reduced because it's a public body, and the position that people find themselves in now is not a helpful process, but they were still fined a significant six-figure sum and asked then to pick up the costs. And as I said, I'd like to take forward, or I think, as I said, my successor, because I'm shortly to leave this post, will want to take up and move forward on the agenda of mental health and particularly violence and aggression. And I think the last thing I just wanted to mention, just in passing, and I know that I'm sure it's been shared between yourselves, and one of the things that I was asked to participate in as part of my tenure was the revised guidance, working with yourselves and colleagues across other unions and other interested parties to revise the guidance for asbestos in schools. We'll see it was slipped out relatively quietly without a fanfare. I can understand to some extent why it was done in that way. That perhaps, you know, we've got other more pressing current elements that we need to address with, but this issue hasn't gone away, and I know that this is there's some strongly held views on this, and this is being taken forward. I think the bit that we should be not proud of, because we've still got the issue, but I think that what we've looked to do within this guidance is actually take it further than the previous guidance. What we've done is asked duty holders to look again at what their arrangements are, and the guidance goes much wider than it has done before, and recognises that actually employers and school employers need to be much smarter than they are before, that they need to be much more aware of any shortcomings or any failings associated with their processes. They need to be aware of any gaps in their knowledge, because we've ended up with false assurances to some extent, or misunderstandings because they've got incomplete information. I've seen some wasted resource because we've asked people to do stuff that wasn't needed, or they've been charged for stuff that wasn't appropriate. And we need to be much smarter in the way that we procure work and the way that we manage our contractors. So it asks people really just to reflect and look again at the way we manage asbestos within school buildings, and all of these this guidance is really quite helpful, because it then sort of sets the tone for the wider public estate, and I think that those people who were involved in it should be very proud of what they've done. I think it's moved it on significantly, and if we can get at schools once we've got a bit of headspace to promote the comms associated with it, that we can flag this and we can start trying to move people forward on what is still a very significant issue that we need to address. So look, that was the areas that I wanted to cover today, Ian. I hope that's helpful to colleagues, and I'm more than happy really as far as I can to answer questions.
Thanks, Andrew. There are lots of questions, and there's been lots of comments in chat as well. So we'll get through as many as we can. And perhaps if I ask you them in twos or threes, that'll be helpful. So going back right to the start, we had a question asking what are the rules around fans and the use of fans in classrooms. We had a question asking what are the legal implications if CEV staff want to come into work contrary to government and medical advice. I'll give you those two for starters.
Well, I did nothing like easy ones just to start with, break the ice. Let's see how we go. I think the bit about ventilation and fans is a really interesting one, and I think that this is an issue whereby when we looked at what the guidance is, and certainly the offering within the current DFE guidance falls short, which is why we've signposted to the REVA guidance, which is why we've signposted to the CIBSE guidance. But there's an awful lot of information out there. You would have seen, and I'm sure some colleagues are aware of some of the SAGE papers that have looked to update then the position on ventilation. And what we're very clear on is that what we want to try and do is maximise the amount of fresh air ventilation that actually occurs. Fans have a point. What we can do is where we've got adequate fresh air ventilation, what we need to do is move some of that about, because we might not have an equity associated with the ventilation, that where we would have stagnant areas in a classroom because the windows are all up one end. Then there is a potential that fans will have their place as part of the complementary activity. But if we're wholly reliant just on fans, which are just moving stuff about, and we haven't then got that external ventilation, all they're doing is just moving stuff about. And you know, we could understand then the worst case is that it's next to somebody who is shedding the virus, and then it's being distributed downwind potentially. So they have their place to play, but they need to be part of then a wider set of controls and considered, rather than just an independent solution. And the same goes for fan heaters as well. I mean, it's great we can use fan heaters as an additional heating source. Again, they move and distribute the air, but we need to use those in conjunction then with proper, appropriate ventilation from outdoors and fresh air. I think we've seen some issues around people keeping doors open internally, and yeah, okay, that works to some extent, but it is about fresh air rather than venting used air into other spaces. In terms of clinically extremely vulnerable individuals, I think that's a really difficult area. I think we've just seen a complete change now at the moment in terms of the lockdown rules, or they've clarified those. The only challenge, the only difference now that's there within the way that people are categorised is the CEVs. And they've been asked or been told to stay home. But I guess it's a real difficult one, because, you know, people have a certain amount of freedoms, and it's a real difficult one for employers. I think we should try and encourage people to stay away, or at least follow that government advice. But it is a very difficult one, and I can understand, because of the passion, because of the way that people believe, and the fact that people really want to come into the school setting and be part of the solution. I can understand why they do that. I don't think as the regulator it's for us necessarily to take a position on that. I think if somebody were being asked to come in who wasn't appropriate to come in, again, we would take a robust stance on there. It's a bit like what we see with the element of PPE, that although there will be some elements where the guidance suggested that PPE isn't necessary, colleagues and others may well choose to use an element of PPE or face covering, and it wouldn't be for the HSE to turn up and say, take that off, you're going beyond compliance. And so I think we'd view it that way, but it isn't a simple dilemma.
No, it isn't, and I can understand you answering in the way that you have. Just perhaps one quick follow-up on ventilation. One of our attendees has asked the question: what should a health and safety rep do if they feel that there's a real problem with ventilation in their classroom?
I think that the element with any of this is to make sure that what we do is we address things internally, and only when we've sort of addressed things internally and we haven't got anywhere that we need then to perhaps raise it with the regulator. I think that there are some real challenges here, and again, the ventilation guidance signposts, the REVA guidance, it signposts the CIBSE guidance, and what we hope is we will have an updated and improved offering on our website. One of the areas where we can look at is we can look at the idea of CO2 monitors. That's something that's referenced within the REVA guidance. That's CO2, not CO. I do mean CO2 because it's a proxy measure for how good the ventilation is. I think we've all got a proxy measure for how good ventilation is. I go into my teenager's bedroom on a morning and I know it needs ventilating better than it does because it feels stuffy and it smells. But a CO2 monitor will give us an indication, and I think that what we'll see is an emerging picture where schools need to look at, and all settings need to look at areas within their school and look at the areas which are going to be more critical. Not all settings are the same. Some are built to much more modern standards. Some are still in really cramped conditions, and some still would be to some extent, I'm sure, not necessarily overcrowded, but at capacity or slightly beyond the intended capacity. And I think a CO2 monitor is something that can be used to at least give us an assessment or a judgment and a scientific input into what the level of ventilation is being achieved there. So I think that can give us the confidence that what we're saying is perhaps correct or incorrect, and then look to see how we can get a steer. But I think that the element is to get that initial agreement. And one of the ways to do that would be the use of a CO2 monitor in those particularly challenging conditions.
Okay, thanks for that, Andrew. Just along the same theme, and I know you mentioned thermal insulation earlier. One of the questions we've been asked is, it says the Education Act has minimum temperatures required in schools. So during winter months, how is this balanced with increased ventilation for COVID risk assessment? And I know you sort of covered this before.
Yeah, I mean, I'm not really going to argue the toss. I think it's interesting. I think if you actually go back to the Act, the minimum temperature has actually been removed in 2012, but it's not about scoring points. I'm sure that I had to have a look at it, but it was there before. It still exists in Scotland. But we've still got the workplace regulations quite clearly, and they cite 16. But again, all of those aren't necessarily a mandatory and aren't necessarily a minimum that we can enforce too. We recognise then the challenge here, and as we've said, this is about that on some days we might be able to get some fantastic ventilation, on others we might not, just because of the conditions that we've actually got, or it might be absolutely unbelievable in the morning, really, really cold, but actually warms up, or as we get some solar gain. So ventilation is one of those things that I think we need to tweak and amend during the day. I think one of the issues that we've got within schools, which is actually really quite helpful, is the fact that what we've got is turnaround times in those classrooms and break times. And even if we, in the most severe conditions, have a degree of ventilation, but that's a minimal degree of ventilation, that we can look to vent those rooms while the children or the pupils are actually out of those rooms, and look then to purge those rooms in a much more appropriate way, not almost every hour, but between the way that those settings are used. And so it is trying to find some sort of sensible and pragmatic solutions. And as I said, it's not an all or nothing. There will be some days when we'll be able to do things better than others, and there will be extreme circumstances when it will be a significant challenge. I do think that we all need to work together. I think we need to recognise that there's an issue here. I know that we've looked at relaxing some of the dress standards associated with uniforms, and for professional colleagues, in the fact that we would wear more layers to make sure that we combat that. Look, we recognise that that's a challenge. There isn't an easy solution. If there was, we would have got it. And schools obviously don't benefit in many cases from managed and mechanical ventilation. And therefore, I think for the time being, the guidance is trying to strike that very careful balance.
Thanks, Andrew. Notwithstanding the cost associated with having to put CO2 monitors and filters, etc., in there as well. There's a few comments and questions around risk assessments. How important is it for risk assessments to have an assessment of risk in there? I'm sure you must have seen many different examples, including just lists rather than risk assessments. How would you answer that?
I think that there's an issue here, and I think that the risk assessment really is part of a process. And as a regulator, and I've been a regulator for almost 30 years now, the bit that I want to see, the proof of the pudding, is actually in the delivery here. You can have the best risk assessment in the world, but actually, if you don't turn that into reality, it's no use at all. And to some extent, although I'll look at the risk assessment as the starting point, because this is you showing your thinking, it's, you're all teachers, so this is about you showing your working, if you like, but the end result is what the answer is, and the answer is, are you actually controlling that? And that's what we're looking to validate. So the legislation is very clear. It needs to be a suitable and sufficient assessment of that risk. That will look at quantifying the risk, it will look at what we can do in that setting, and it will look at what the solution is in that setting. And as I said, there is a middle way that we can end up with a gold-plated, polished risk assessment and not put that in place, or we can have not quite the bag of a fag packet, but if there's no real concerns in the way that setting's actually being managed, and we're on it and we're live to the event, then I'm not going to say that the risk assessment isn't something that's not important, but it is that touchstone. And it is about, the element is about how we communicate it, because it is a live document. This isn't something that sits on a shelf and yes, deal done, done it. Actually, it's something that we revisit, something that acts as a point of discussion. And that was why it was very important that union colleagues and employee representatives were involved in the process of actually developing risk assessments and developing controls, because those controls actually need to be effective. They need to work. We can't end up with something that is completely unrealistic for that setting and unworkable. But as I said, this isn't a one-stop review. There's an ongoing need then to update the risk assessment, review it, review the controls and see if they're effective and come back to it. And as I said, the document needs to make sure that what it does is it communicates very clearly what it is that we're actually going to do.
Okay, thanks for that. And when you were talking earlier, you were talking about social distancing, and I think you mentioned that what was being reported was very positive. What can you tell us about the findings on social distancing? Because you'll see from the comments in the chat and a couple of the questions, in the vast majority of schools, it's nigh on impossible to socially distance. So if you could sort of qualify your comments on positive experiences with social distancing, that'd be good. No,
of course, and let me do that, and let me be clear. I think that the challenge we've got in a school setting, which is very different to any other setting, is that the compliance benchmark here is very much pegged to the guidance, the DFE guidance. And as I said, this isn't HSE guidance, it's public health led guidance that the DFE have put together in conjunction with that. And it's right that we look to question some of the thinking there, but this is the public health led advice, and you all understand that the requirement for social distancing between the pupils themselves in a number of settings is it's not mandated in many of those settings. And I said what we can actually achieve in some settings depends on any number of parameters, including then the size of the classroom, including the key stage, including the activity that the individuals are doing and the amount of support that each individual needs. And that becomes a real problem. What we do try and do, because it's not an all or nothing issue, is that where we can get that social distancing in certain situations, that we will do. The key area in most classroom settings is that the teacher or the professional staff can maintain that distancing within that setting from the pupils, but we recognise that that's not always achievable just because of the practicalities associated with it. But clearly, as we get the key stages get older, and as the things change, and it becomes much more important then in the older cohorts to try and get that social distancing. But again, it's still not mandated. And our challenge as the regulator, and I don't mean a challenge, but it's the reality, is that we can only regulate against that guidance. And as I said, the issue that we're looking at really is how we look at and focus on the risks associated with the teaching staff. And I'm not saying we're not interested in the pupils, but what I'm saying is that the guidance is much clearer about the need for social distancing for the teaching staff than the pupils. We've seen some great solutions, we've seen some less able solutions, and I don't profess to have seen all workplaces, but clearly we have some very tight classrooms out there in real life.
Okay, thank you. We certainly do. Just linked into that, there's a question here around pregnancy. Regarding pregnant women of 28 weeks, there seems to be inconsistency across countries and counties about working from home. We understand no risk assessment is risk-free. However, in school settings, particularly with younger children, a 2-metre social distancing cannot be maintained. Therefore, pregnant women of 28 weeks should work from home. What is HSE guidance on this?
Well, again, and I think that here's the difficulty in it. I'm going to sound slightly like a broken record, but we are guided by the guidance that's there, and we can only regulate against that guidance. And as I said, we've made, and again, we've all seen that it's been updated. There was something came out yesterday, as we all appreciate, about the mandating of face coverings and the fact that we've just got one category, the ECVs, and then we look at how we look at other people who could be perceived as more vulnerable or with protected characteristics that put them into that category. As I said, our difficulty is that the challenge here for you and the answers here is back to public health rather than us as the regulator. I'm not going to say we're piggy in the middle, but we can only go against whatever the guidance is, and that's what we're being tasked to do in this instance. It's not ideal. And is not a place where we feel comfortable, because normally we are the regulator and the person who sets the benchmark, but not in this case.
Okay, thanks for that. Sort of linked to that answer and following on, and you just mentioned face coverings there. I know in Lancashire, the HSE visited a cluster of secondary schools that had actually started term with all children wearing face masks in the classroom. Would that fit into your category of good practice? What's been fed back about that?
I think it's a really interesting issue, the concept of face coverings and what face coverings actually achieve. And you would have seen that what we've seen is a very clear changing picture. I think that there's a number of camps that this falls into. I must admit that the line that HSE is taking is that we look at PPE, and face coverings aren't a recognised element of PPE, albeit that they offer a wider collective solution. But because there's no set standard to what we've got in terms of face coverings, it's very difficult to make any judgments associated with it. Clearly, we've seen a number of different scientific papers, some of which give conflicting outcomes here. In the fact that, yes, in some instances they stop then the near field aerosol transmission risk and the direct splashing from singing and shouting and all of the other things that people do in close proximity to one another, and therefore there could be benefits associated with that. It's less clear as to what we do in terms of the far field aerosol transmission, in terms of the wider aerosol that we see associated with, and why we have and calling for then this ventilation. So I think that what we're seeing at the moment is an emerging picture. I think that there is a direction of travel here. This is very much a public health-led issue. And what you'll find is, and again, we're clear that because the wearing of face coverings is actually covered by a separate piece of legislation, the coronavirus regulations, and it isn't then policed and regulated by HSE. Now, that's not necessarily to say that's right or wrong. That's just the way that it is, and the onus to wear a face covering in public or in other settings where it's mandated sits very much with the individual, and that's not an area that the HSE regulates. We don't regulate against individuals because they're not necessarily doing anything. We look at the employer and what we can do as a collective solution. So it's a very difficult area. I think that, that you can see the direction of travel. You can see what's trying to be achieved. The evidence, I think, or there is evidence gathering as to the effectiveness or the relative value of these. I think the early discussions was around whether or not that there was actually an additional risk associated with face coverings, just donning and doffing them, and children, and to what they did. I mean, you know, my kids wear their face covering. The first thing you do is come back and put it on the kitchen countertop. Well, you know, thanks guys, that's great. And so, you know, there are pluses and minuses with all of these things. And I think that it is very much watch this space. But as I said, this isn't an area where we find ourselves as the key regulator in this instance. But what we will be looking at is, well, what arrangements do schools have in place to ensure that those procedures that they're looking to follow are actually implemented and following. And as we said, it's in 11 plus, but I'm certainly not going to go against evidence where I think that is. There's many reasons why some schools have ended up with less transmission risks in their settings. Face coverings is simply not the only variable there.
I'll just come back on that if you don't mind, Andrew. So what would be the other variables that have kept cases and bubbles being sent home and isolations lower, based on the experiences that you've seen over this last few weeks?
Well, I think you've got to take on all the relative variables. So if you look at all the transmission routes, so we've got a series of transmission routes, and that's quite clearly going to be direct contact. It's quite kind of clearly going to be shared services. And so the close personal contact is about, well, how big your space is. The surfaces is going to be, well, how good and how enhanced is your cleaning? How effective is that? What's the personal hygiene of the individuals there, and the culture and access to sanitizer and washing facilities? And then you've got the third issue, which is quite clearly the issue around ventilation and what do we do about the far field transmission. So, you know, much of that is actually going to be setting related. And, you know, face coverings isn't the be all and end all. It will add us something, but it isn't to be used instead of. It's going to be used very much in addition to and add value to anything else that we've got. And I think that, you know, I'm very much at pains to say that, yeah, we can put on PPE, we can put on face coverings, we can do all of those things, but we need to maintain the other effective controls that are there as best as we can in that setting. And as I said, some settings are much more fortunate than others. We've been to many settings that actually aren't at capacity. They're able to use their rooms way more effectively. And we've got other schools who are less fortunate and perhaps are overstocked or overstacked, let's suggest. And there is then more potential for bubble transmission. I think the other thing is about how we use our outside space and how we can use one-way systems to stop that. And again, you know, we've got some settings that where effectively there are no corridors and each classroom has a door to the outside. That's much easier then to stop the bubbles necessarily coming into movement into contact with each other. And again, it's looking at the separate areas within the school, and you know, some of that works very well. And as I said, there are some spin-offs associated with keeping the bubble separately. And you know, I was chatting to some colleagues from the Welsh Government this morning, and it's been a long time since they've heard much about bullying, because by keeping sort of the younger people away from the big people, actually there's some spin-offs associated with this, not just least of which is the COVID transmission.
Okay, I won't press you on numbers and percentages on schools that have got plenty of space and those that don't, but I'm sure the people that are on the call will be able to reflect on that. I don't want you to come back on that.
Well, it is definitely a matter for the DFE, and I think they're only too aware of what their estate looks like, because they've done their condition survey, and they will identify where their funds need spending, I guess, but it's very much a matter for them.
Okay. Change the subject now. We've had a question on asbestos. You talked about it briefly before, and the question is asking, can you please clarify who is the duty holder when asbestos is being removed from a school, or in the case of a school being demolished with significant asbestos present? Is it the school, i.e. the head or the governing body, or is it the contractors? In the case of an academy chain, I'll just finish the question. In the case of an academy chain, is it the school or the chain who is responsible, or is it the DFE? So a couple of things there.
Yeah, and I think that I'd love to be able to give you an absolutely straight answer on this, because I think I probably know an element of some of the background here where perhaps things haven't necessarily been as clear as we would want them to be. I think to some extent it depends who the client actually for the activity is. So it comes back to the construction activity as to who is the client. And what happens in many instances, and certainly in terms of the procurement of new schools and the demolition of old schools, is the client is actually transfers. And although the trust or somebody will be the end user of the new school, which has been built in the new facility, the client actually isn't that. It's the local authority. And then what we've got is the contractor working through that. I think that you would have to look very carefully at the way that the thing was procured, the way that the payment was going. But most of the schools now are still new builds, are still built with local authority money to some extent, and they then retain the client, and they will be the client for the demolition. And so we would be focusing on them. And I appreciate that that's not necessarily straightforward, but that's in a sort of separate new build and finish. And demolition. If we were looking at work that was actually happening within the site itself, and the undertaking was so within part of what was an occupied school, then clearly the duty holder in that instance would be the employer. And as you appreciate, the wonderful way in which we've got the fragmented delivery of education in England means that the employer could be one of any number of groups of people, depending on the governance mechanism within place in that school.
Thanks very much, Andrew, for your time this afternoon and for answering those questions so thoroughly. Thanks very much to Sam for the sign-in and for all the officers for their support this afternoon. Thanks a lot. Bye.